Hi, my name is Tiffanie Wright. My student ID number is 329-4416. This is Veterinary Technology Introduction for the fall semester 2018. Hi, this is Shinobu, and we're going to be doing a nail trim on him. Our supplies needed is quick stop, which I already have some right here in a container, nail clippers, Q-tips, and then a little bit of water to moisten the Q-tip to put on there. The reason why we put it on the lid is to prevent any blood or bacteria to be growing in the main container. So the reason why we want to do this is for health purposes. We don't want the nails to be too long to where it grows into the pad of the paw, and if it does, then it can cause infection. So a way to identify the quick is through the nail. So the quick is the blood and the nerve endings that are within the nail, as you can see, and it stops before the clear part of the nail is. With black nails, it's a little bit more difficult to figure out where it is, but there is a little gap between the nail and the quick, which is what is called the bridge. And so we want to clip a little bit, not too much to where you accidentally clip it, but enough to where you can actually see that bridge. And with black nails, it is actually black and it's a little mushy. But since Shinobu here has clear nails, it's easier to identify. So Shinobu is pretty good with nail trims, but I'm going to restrain his head just a little bit. So the way we want to do this is we want to clip with the direction that the nail is growing to prevent any informalities or unnatural growths to happen, but not enough to where we're going to actually hurt him. So I'm just going to clip right about here, and as you can see, it's okay, Shinobu. Okay, sorry. So as you can see with that nail, there's a little bit of a dot right here, so that is where his quick actually is, and I'm not going to clip any further than that because I don't want to cause any pain. And the long-term effect of clipping the quick is actually distrust between the patient and the technician, and the fact that he can actually get an infection due to exposure to pathogens such as bacteria or feces, and it's not something we want to do. The short-term effect is the fact that he will be in a lot of pain, and with that quick stop, actually, because he doesn't have enough plaque in the end of his vessels, it doesn't clot correctly. So we want to make sure that we want to stop the bleeding and reduce the pain as much as possible to make sure that our patient is more comfortable. So I'm going to go ahead and do another nail. And I'm going to restrain Shinobu with my elbow. I'm going to do one more. And see, same thing. And Shinobu's really not having it, but that's okay. So you can see the same thing. You see that little pink part, which is normal. If your patient is starting to be a little incompliant, that's okay. You can simply take two of his paws, roll him over, and restrain him as such. This way you have more restraint on him so he doesn't turn to bite you. And you get a better, clear visual of his nails, so that way he can't fight. So I'm going to do one more, and Shinobu's not much of a fighter, but that's okay. And same thing is I'm not going to clip too close to his clicks. And this is what I was talking about earlier about doing a little bit with the black nails so you don't accidentally clip that quick. And here you can actually see a little bit better of where that quick actually is. So I'm actually going to clean these up a little bit. Okay, and that is Shinobu's nail trim. And for any time that if we do accidentally quick him, I would take a little bit of the water from my syringe into the tip of the Q-tip. I would dunk it here in the quick. I would take whichever nail that he's bleeding from, and I would apply it. So I'm just going to use any nail, even though he's not bleeding, and I would apply enough pressure to where I'm not hurting him or causing any discomfort, but enough to where it can stop the bleeding effectively. And that is how we do a nail trim for a canine dog. Hi, this is Ash, and we're going to be doing a nail trim on her. Now Ash is a front declaw, so she doesn't have any nails on the front. My supplies here are feline cat nail trims, the syringe of water, Q-tip, and quick stop, and like I had before, I have some in the lid to prevent any bacteria or blood being in the main container. So a way that we expose her nail is one, we're going to hold by her scruff and lay her down on her side, and I will support her back with my arm. I'm going to press a little bit on her toes, not too much to cause her any discomfort. And you can see her nails. And cat's nails tend to be clear. With hers, you can see where her quicks are, which is where the blood vessels and the nerve endings end. And it's the pink part versus the clear. And you can see it a little bit on that. So that is where her quicks are. And I'm going to hold her down a little bit to do this since I don't have another pair of hands. She is very, very good with nail trims, so she's not going to cause me any trouble. So like with Shinobu, we're going to avoid hitting that quick. So. And just like that. And the same with her other nail. And now if I did accidentally quick her, what I would do is I would take the syringe with the water, dab a little bit on the Q-tip, and dab a little bit in the quick stop, and apply to one of the toes. I'm going to do a little bit of pressure, not too much, to prevent any pain or discomfort. And the reason why we want to clip in a certain direction, in the direction I did, which is the same direction that the nail is growing, is to prevent any unnatural growths and informalities for when she extracts and retracts her nails. The long-term effect of this could be infection and painful and distress between the patient and the technician, versus the short-term is she being a lot of pain and very agitated, which she's already kind of agitated. But she's a good kitty. But that is how we perform a nail trim on a feline. If I had another set of hands, they would restrain her in the way I demonstrated before, while I extract her nails and do the nail trimming. But I'm only going to do the one paw today. So that's how we nail trim on a cat. Okay, this is Shinobu again. We're going to be pilling. This here is Chlorotabs, which is an allergy medication. It's a 4 milligram tablet. I actually already have his tab out. It's a whole tab. He's a 25-pound dog, so it's a healthy dosage recommended by his veterinarian. So, because his face is facing towards my left, I use my left hand. I hold it between my index and my thumb to provide a better way to slide my hand within his mouth. So I'm going to hold his head up this direction to where his neck with his esophagus is one huge line. And I'm going to open up like this, take my pill, and stick it into his larynx, and I'm gonna hold his muzzle shut. I'm gonna rub his neck to stimulate swallowing, or I can hold his nose to make him breathe. And make sure he actually swallowed it, and he actually swallowed it. So that is how you pill. Hi, this is Ash again, and we're going to be doing pilling. She's not on any medication, so she will be getting temptation treats. And this is what they look like, and I already cut one in half. So the way we do this is we're going to hold it between our thumb and our index finger, and we're going to stabilize her neck to where it's perfectly in line, and I'm going to push this to the back by her larynx. So because her head is facing to the left, I'm going to use my left hand. So here's it. And we rub the neck to stimulate swallowing, and then we can tap on the nose also to imitate that as well. Some people can use water if some tablets have a certain coating on it that can stick to the esophagus to prevent cysts or ulcerations to form. So let's see if she swallowed that. And she did. And that is how we pill a cat. Hi, this is Shinobu, and we're going to be doing a free catch urination. The supplies we need is a bowl or ladle to catch. I'm using a bowl and a syringe to catch from the bowl. And the syringe has to be labeled with the pet's name and its surname along with the date. So as you can see, I have Shinobu with his last name and the date. Okay, and we're going to see if he will go up. And we want to do it midstream, which is where he is in the middle of peeing. And the reason why is because we don't want any bacteria that's already on his penis to contaminate our sample. And the way we do that is it's in the middle. Shinobu, up, the potty. Like that, and as you can see, we have our sample, so I'm going to go ahead and collect it in our syringe. And that is how we do a urine sample. Hi, this is Shinobu again, and we're going to be doing a gauze muzzle. So the supplies needed is a roll of gauze. This is a 2-inch, which is obviously a little bit too big for Shinobu's muzzle, but we're going to go ahead and do it anyways, but I'm going to fold it in half. I already have one out right here and can just play with it. But the way we do it is we're going to make a loop to make a tie, and we want this to come underneath his muzzle. So the way we normally do this is we would come up from behind. If it was a more aggressive dog, I'd be a little bit more cautious. So we would do this, and then we would come up and tie from behind his ears. I normally tie in a bow, so in any situation that I need to release him is just pulling on it. And the way to determine if this is too tight is he would be a little swollen or a little puffy within his cheeks. If you would know it's too loose, is he would be able to open his jaw freely. He cannot, it's not too loose, it's not too tight, and I can still pull it up a little bit and get my finger underneath. So it's a good measure of stability. And whenever we need to pull it off, like I said, we just untie it and it comes right off as such. And it comes off freely, and he's able to do it himself if he really wanted to. And that is how you gauze muzzle a dog.